Thank you, comrades. Oh, I mean, my fellow Americans. This is the angriest mob I've ever seen. Well, it's my honor and privilege to stand before you and represent hundreds of doctors from around the country who've joined with us and thousands more who will join us very soon after today. Never in my lifetime have I seen this kind of action and emotion from doctors. We're finally standing up, and for good reason. Congress and the White House are threatening our profession.
That's right.
Our ability to properly and appropriately care for patients is being put in jeopardy by a Congress who is more concerned with ideology than the welfare of its citizens. This Congress is led by individuals who see things far differently than we do when it comes to health care. And that, my friends and colleagues, is the problem. Few of us here around the country would dispute that health care needs a tune-up. However, how can our leaders not see what we in the American public sees? Of course they do. So what we're debating represents something far different from fixing health care. The word reform is a shorter word for reformation, which is the same as transformation. And we don't need a transformation of health care. We just need to zero in on the problems and fix them. We have the best health care in the world, and everyone here knows it. Most every great medical discovery and innovation came from here. We've got the best hospitals and doctors, the best diagnostic testing facilities, and the best treatments. Politicians with an agenda would have you believe otherwise, assisted by a media that has failed to do its job properly. They would have you believe that we doctors are driven by dollars and not compassion, by self-interest rather than our patients' interests. How can people who would do and say whatever it took to get where they are ever understand why we do what we do every day? How can they even comprehend the sacrifices we've made, like Scott Barber told us, to have gotten to the point where people would trust their lives or the lives of their children with us? They want you to believe that we would cut out a tonsil rather than treating a sore throat. Or cut off a body part if it meant $50,000 more in our pockets. Who would believe what a doctor such as myself would say if we were truly capable of doing this? That's what they have set out to do. To discredit our words so that they would ring hollow. They've made a big mistake. They've stuck a stick into a hornet's nest. Does healthcare need a tune-up? Yep. But like your car that may need a new timing belt when you bring it in, you don't want to see the mechanic taking out the engine and the transmission when you bring it in for that. Healthcare does not need to be dismantled. It needs targeted solutions to specific problems. As doctors, we like to break down problems into their parts. Access to health insurance is a problem. So are costs associated with paying for this healthcare insurance and for medical care. And medical liability issues have caused a tremendous strain on this system. But not one word is uttered about this because Congress lacks the guts to bite the hand that feeds them. The problem with access to insurance can be fixed almost immediately by issuing vouchers to the poor to purchase health care from one of the 1,300 established carriers.
That's right.
Those who can't qualify for vouchers, but who still cannot afford to get insurance or can't obtain it, should be able to purchase it and get tax breaks for it, like employers.
Right.
To address affordability, insurance markets need to be expanded so that people can purchase insurance across state lines and shop for the best price. pools need to be expanded to encompass states or regions of the country so that risk is spread over larger groups of people, thereby lowering costs. This way, pre-existing conditions will no longer be a barrier to entry into insurance. And patients need to become responsible consumers so that there's a connection with the services they receive and the money that it costs.
That's right.
This can be done easily by promoting health savings accounts, something that will disappear if Congress gets its way. And finally, doctors and hospitals would be willing to post their fee schedules if it meant that consumers were going to be able to shop for insurance and get a better deal. And then there's liability, medical liability or tort reform. Currently, we spend $200 billion a year because of defensive medicine, getting an extra MRI scan, doing an LP that may not need to be done just because we're afraid of getting sued if we miss something. We also spend $200 billion a year on premiums between doctors and hospitals for malpractice. So if we even took a fraction of this money and we used it to revamp the medical system, it would not only help take care of the things that are necessary, but it would save Medicare, which is projected to run out of money in 5 years. So I'll tell you what we don't need. We don't need a single payer. No! We don't need health insurance exchanges or co-ops. No! No individual or employer mandates. No! No trigger. No! No national health board with another unvetted czar running it. They are all versions of the same thing. Government control over health care with rationing to contain costs and interference with what you and I do every day, which is to take care of the sick and injured. So my friends, I'm a surgeon, I'm not an activist, but I've been driven to this point listening to people debating this issue who have no business debating it. Doctors need to lead the way when it comes to health care policy and not take a back seat. Our politicians have just studied the issue. We've lived these issues for thousands of hours, caring for millions of patients.
Not academic.
Unfortunately, up till now, we've had no debate, no voice in this debate, but now, starting today, we do. Everyone is shocked to learn that the AMA is not this voice. They represent just 17% of us. They've sold us out for a few pieces of gold. Well, my friends, we have to step up as doctors, and we have to be that voice for doctors and our patients across this country. Will their plan lead to better health care? More affordable health care? In fact, just the opposite. The path we are on now is untenable, but the road that our leaders are thinking about directing us down will take us over the cliff. It will only enrich insurance carriers further and transfer power over everyone to the federal government, while leaving Americans holding the bag and doctors' hands tied. Who would you believe about this, America? The people who took down the housing market and took over the banks and the auto industry, or the very people who are taking care of you, who you've trusted with your lives and well-being every single day? I'd like to inject a bit of Latin into this speech to close. First, primum non nocere. First, do no harm. This is the first principle that we all were taught in medical school, and it comes from the Hippocratic Oath. It reminds us to consider the harm that any intervention will do. And remember this as we debate health care. Next, e pluribus unum, or out of many one. How appropriate to invoke this in the epicenter of democracy. It's our motto and our creed, but as doctors, it's our duty to come together with one single purpose, and that's to shine the light of truth on this debate and to illuminate the path that needs to be taken to turn this problem around. And finally, caveat emptor. or let the buyer beware. Because if you buy what Congress is trying to sell us right now, there is no one to blame for the outcome but yourselves. And you will get what you pay for, and believe me, my friends, we will all pay dearly. The unintended consequences of this action will be far worse than anyone else has told you, America. So, thank you for coming out here today. God bless us all and our patients. Let's help them, let's help our leaders work to get on the right path and to do what's right for America.